Adolescents and young people represent the future. For most of them, this period of their lives is a time of discovery, change, and hope. It is also about experiencing puberty, initiating their first romantic relationships, and for some, starting sexual relationships. There are 158 million young people in Eastern and Southern Africa. They make up 33% of the total population, and their number continues to grow. Among these, 2.6 million are living with HIV, and this region is the center of the HIV epidemic globally. To help reduce HIV and improve sexual and reproductive health, better education and health services are critical. Meet Joseph. Joseph is a 13-year-old boy living in a city. He completed primary school and now he's in secondary school. On average, only 30% of children in this region make the transition to secondary school. This is Celestine. She is a 12-year-old girl living in the countryside. Celestine successfully completed primary school and is now moving to secondary school. Girls are more likely than boys to drop out of school in this region. 50% don't reach the last year of primary school, and even fewer continue to secondary education. One of the reasons is early pregnancy. By the age of 17, 1 in 5 young women in some countries have started childbearing. Once they are in school, young people need a quality education that is relevant to their lives. Education is an important protective factor against HIV and other health risks. In this region, there are 50 new infections per hour among those aged 15 to 24. Despite this, less than 40% of young people have adequate HIV prevention knowledge. Young women are more affected by HIV. The regional HIV prevalence among young women aged 15 to 24 is 4.3%. This is 2 1/3 times higher than among men of the same age. Good quality comprehensive sexuality education has the power to change this situation. Comprehensive sexuality education should be age-appropriate, non-judgmental, accurate, and delivered by trained teachers. It needs to be supported in and out of schools. Curricula need to include essential topics such as puberty, relationships, decision-making skills, HIV and pregnancy prevention, gender equality, and sexual and reproductive health and rights. Sexuality education does not lead to earlier sexual activity. In fact, it helps to delay it. In 2011, only 30% of the required topics were being covered in school curricula in some countries. This means that young people are not being adequately prepared to deal with HIV and other health issues. Joseph is one of 2.6 million young people living with HIV in this region. Like any other young person, he needs comprehensive sexuality education that will teach him what he needs to know about HIV and reduce stigma faced by people living with HIV. Joseph is now 18 and is finishing secondary school. Because he had comprehensive sexuality education that included safer sex and condom use, Joseph knows how to have a safe relationship, how to prevent unwanted pregnancy, and prevent the transmission of HIV. More than 60% of adults in this region agree that adolescents aged 12 to 14 should be taught about condoms at school. Celestine is now 17, a skilled and confident decision maker. She knows she can choose if, when, and with whom she wants to be sexually active. Many adolescents in this region start having sex around the age of 17, but a significant number are sexually active at a younger age. Sexuality education and access to sexual and reproductive health services are a right for all young people. Joseph and Celestine now know that equality and respect are important in relationships between men and women. But this isn't the same for many of their peers. Gender inequality and gender-based violence are serious challenges in the region. Between 15 and 35% of young women have experienced gender or sexual violence. Education, however, can improve gender equality and reduce violence. But education alone is not sufficient. It needs to be supported by sexual and reproductive health services that are safe, confidential, welcoming, easily accessible, and affordable to young people. These services include contraceptives and condoms, voluntary male medical circumcision, pre- and postnatal care, safe abortion where legal, HIV testing, HIV and STI treatment and care, and prevention of mother-to-child transmission. Celestine knows how to manage her sexual health. She will be able to access the contraceptives she needs, even though in the region, only 1 in 2 women has access to the kind of modern contraception that they need and want. It is harder for adolescents and younger women to access contraception than for women over 24 or for those who are married. Unintended pregnancy is a reality for many adolescent girls and young women. Maternal mortality is among the leading causes of death for young women. In this region in 2008, there were an estimated 2.5 million unsafe abortions. Celestine knows that regardless of their age, marital or legal status, young people have a right to access the services that they need. HIV testing, condoms, male circumcision and treatment are important elements of HIV prevention. Access to condoms for young people is improving, but is still inadequate. Condom use is also not the norm. Only 45% of young men and 34% of young women used a condom the last time they had sex, with some countries having rates as low as 4%. Whilst more than 70% of young people know where to get an HIV test, only 40% have ever been tested. Thanks to health services, Joseph's HIV status was diagnosed and he started ARV treatment at the right time. He continues to receive support to manage and adhere to his treatment. There are only 5 countries in the region where more than 75% of people with HIV are on treatment. Access to treatment for children is even lower. Life has changed for both Joseph and Celestine, and attitudes towards young people's sexuality have changed, and the education and health sectors are working together. Thanks to the sexuality education and the sexual and reproductive health services from which they benefited, they can now make informed decisions about their lives and relationships. They can stay safe and healthy and choose if and when to start a family. Celestine knows that when she decides to have a relationship, it will be safe and equitable. She will be able to talk openly with her partner and plan and use the appropriate contraception and take the steps needed to prevent HIV. Joseph has access to the services and the support to ensure that his wife and child will remain HIV-free. Joseph and Celestine are the faces of what could be the first generation of young people with no new HIV infections, where men and women have control over their sexual and reproductive choices, and where there are no barriers to accessing services or education. With bold leadership and bold actions putting young people at the center, with the education and health sectors working more closely together, with the engagement of young people and the involvement of their parents and communities, we can create a generation of global citizens who are educated, healthy, resilient, socially responsible decision makers with the capacity to contribute to their community, country, and region. It's time to act now.